feel like I've had so many lows this year that...
Hey guys, I'm Dr. Shireen Idris, a board-certified dermatologist, and this woman caught my eye because she has a condition that is not readily recognized by the medical community, and awareness should be raised around it. It's called topical steroid withdrawal, also known as red skin syndrome. Now, the why and the how of this happens, we do not know, and much more research is still needed. But we believe that this happens with long-term steroid use, especially mid to high potency steroid use, because topical steroids, the creams that you get from your doctors, come in various different strengths. Over the counter is extremely low potency, and that's like hydrocortisone or cortisone 10. But once you go into prescription, it becomes much stronger, especially when you have a chronic condition like eczema, because most people with eczema are on steroids off and on throughout their life. Now, what we do know is that it tends to occur mostly in adult women and people who've used it on their face or on their genital areas, because those areas can definitely be affected by eczema. But more than that, we do not know. What are the common symptoms? Pain, itch, burning, flaking, wrinkling of your skin. With long-term chronicity of this condition, you can end up getting hair loss, fatigue, depression, and you'll end up on disability. And most of these people with chronic topical steroid withdrawal syndrome end up homebound. So the good news is there is some hope on the horizon. I am in nobody's pockets. I am paid by no one except myself and my patients. But Dupixent is a medication that has recently been approved, also known as dupilumab. And this is one that can be very exciting for people with this condition. So if you know anybody who has topical steroid withdrawal, or if you yourself suffer from it, please find a local board-certified dermatologist that you trust and ask them about Dupixent and to learn more about it. You can also go, by the way, on the National Eczema Association website. They have a lot of information there.
Also, I just want to say to all the Black women out there, like, the data on your health is missing. There, other than like the fact that Black women are 4 times more likely to get anemia compared to their white counterparts. I treat so many Black women. Whatever symptoms you feel that you think that other people tell you is crazy, you're not having it, this is just depression or anxiety or ADHD, come talk to me. Like, we have been working with Black women on this for a very long time.
I got prescribed this for over a year and a half. I was losing locks. This was by my allergist that I had, because I was getting allergy shots for 2 years because I'm allergic to pretty much everything, cats, dogs, all that. So anyway, nonetheless, this doctor prescribed me this. And I have been prescribed this for over now 2 years at this point. So what I'm saying is, I'm telling him I'm experiencing itching and having hair loss and all that. It's not the shots, it's not this, it's not that. You're literally prescribing me something you should know that causes hair loss. This is not supposed to be prescribed over 3 months, 90 days tops, not 2 years. Go to a dermatologist well known in the T state that I told you not to move to. She is my shade. You would think she was a PCP. That's how much time she spent with me. A PA who was still in school, Asian woman, had more time, and we talked. And let me say this, I had to go out of state, get a consult out of state to find out MCAS and psoriasis. So when I say, yeah, it doesn't matter if someone's a woman, doesn't matter they're your shade, does not matter. Because these people are in fields, and the thing is, they're not even thinking anymore. They're not assessing. And I'm not talking about all of them, because you have some absolutely trailblazing ones who are here. But those are far and few in between. And when you actually question this system, they look at one more thing. South Asian is different. So I do not recommend, normally I don't recommend South Asian at all. They have dominated the medical field for lots of reasons, because they really will endorse this whole gaslighting thing. No, I have not had one good experience, and I've had over 10 different providers in different fields across the way. Absolutely not. Every time. Haven't had one. Have not had one who did not gaslight me, who didn't go with the agenda that these people are pushing. So no, for me, being neurodivergent, a Black woman, and all those things, because I'm aware and I know things, all you had to do was ask. I even had a psychiatrist at the VA. She never knew I was even married. Saw her over a decade. Never even knew I was in my PhD. Didn't know. Because these people don't care. They will write you off. And it's like, I shouldn't have to be a doctor, a nurse, or a PhD for you to respect what I'm saying.